every 3 seconds, someone in the world develops dementia. That's how common the degenerative memory disorder is, affecting 50 million people globally. Alzheimer's disease is the most common form of dementia, accounting for 6 to 7 of every 10 cases. Yet there's no cure for the condition, which not only damages people's memories and the ability to look after themselves, but is also very overwhelming for their loved ones and their carers. Now, this year has been especially challenging for Alzheimer's patients as COVID-19 has severely compromised their capacity to provide care and the support that they need. September is World Alzheimer's Month, and today we discuss how people with Alzheimer's have been affected by the pandemic and what support they critically need. For this, we speak with Sharon J. Shah, Clinical Associate Professor in Neurology and Neurological Sciences at Stanford Center for Memory Disorders. It's lovely to have you on our show today. Thanks for joining us.
Thank you for having me.
We also connect with Carol Cox, Professor at the Graduate School of Social Service at Fordham University, based in New York. It's lovely to have you on. Thank you so much for joining us today.
Thank you for having me as well.
Well, let's start with you, Sharon. So this year we've been hit by this awful pandemic. How has COVID-19 affected people suffering from Alzheimer's disease, and why have there been so many fatalities among patients amid this pandemic? I mean, have there been significant links?
Yes, I think it's all hypothesis right now. We know a lot of people with Alzheimer's disease are often in nursing care facilities or assisted living facilities, and in particular, those have been hit hard. In the United States, some reports suggest that 40% of the fatalities are people who are in nursing homes. And that's not just in the United States. There are other places in Canada and other places around the world in which people in nursing homes and Alzheimer's disease are selectively affected. The question is, why is this occurring? Does this coronavirus selectively affect people who have Alzheimer's disease? Are they at greater risk? And I think one thing we cannot separate but should think about is whether living in nursing home facilities provides an extra risk. So because they're in closer quarters, they're older population who are also more vulnerable. Being isolated as well. So if you're not in a nursing home facility, is there less access to care because they're afraid to go out or they shouldn't go out? They're having less visitors as well, so that contributes to loneliness, anxiety, and just greater prevention or less preventative care.
And now, Carol, how has COVID-19 affected people suffering from Alzheimer's disease really disproportionately?
Well, these are people who are incredibly vulnerable at the best of times. COVID has simply put another very, very large challenge on them and on their families. There's no question about it. Certainly within the institutions, but also in the home, because people who had been stimulated and who had received support from family or in the nursing home, that's not happening now. So that people are deteriorating much quicker. The isolation is very, very important, and it has a strong impact on people with dementia. There are cases continually in the newspaper about, there was one very sad case about a man who'd been caring for his wife just the other day in the New York Times for over 25 years, who has dementia. He had to put her into a nursing home because he did not have any support anymore at home. And now she doesn't even recognize him. She went downhill so quickly from being institutionalized, which is another horrible issue, because if you're taking people who've been used to the supports within the family and they have to transition to an institution because of COVID, they need a lot of support with this transition, and that support is often not lacking, particularly since we have such stringent requirements here about who can visit anybody in a nursing home, which only isolates people more. So it's sort of been as bad as it's been for older people in general. People with dementia are really, really at risk for deteriorating.
And it's hard enough for families dealing with dementia in the family, but this pandemic, as you just mentioned, has just made it devastating, really. And Well, Sharon, some researchers have recently found that people with particular gene variants are at greater risk of developing Alzheimer's disease, as well as COVID-19. So are Alzheimer's patients more susceptible to the disease?
Yeah, that's a great question. There's one study that looked at this one genetic variant called ApoE4. And this ApoE4 allele is a mutation that increases the risk for developing Alzheimer's disease. It does not mean that if you have this allele, you will get the disease, but it's definitely a risk factor. And so one study had looked at about 382,000 people of European descent and found that people who had this ApoE4 and had 2 copies of it, which increases the risk for developing Alzheimer's disease, also had a higher likelihood of having COVID-19. The question is it just causal, or is it associative, or is it causal? So, and then this is for European descent. So does that apply for people for Asian descent, African Americans, and other ancestries? So I think this is very good information to obtain. It's helpful, but I don't think it tells us necessarily whether it causes or gives us a greater risk of developing COVID-19.
Well, Carol.
Let me just add something to that, since we're talking about the institution. What we've had in the United States, and I don't know how this goes certainly in Asia, I think it's an issue in Europe, is that the people who are taking care of people in the nursing homes often are the ones who are continuing to infect people because they are going from home to home to home. They're not, they are so poorly paid in America that they take on several jobs. And so they, and if they have a symptom themselves, they often don't get any money at all if they don't go to work. So we know that they go to work, and that has been an issue in terms of infecting. We don't know how much, but it's certainly there. And again, as Sharon says, many of the people in the homes already have dementia or Alzheimer's. So it's hard to know. I mean, I'm not an MD, but I would certainly think it's hard to tie in cause and effect. It could simply be correlation that they are so vulnerable and they're at a higher risk, which is causing it.
And Carol, what really have been the challenges this year for carers of patients with Alzheimer's disease? I mean, of course, we can't forget them.
Well, it's been in the United States again, where the most care is done informally. The government does not really come in at all, very, very little. So most of the care has been on the family. And the family have often used support services. Well, those support services are virtually done because you can't have direct contact. So caregivers have been really stressed, and very, very high level of stress of trying to do everything for their relative. And the relative is stressed as well because often they went to a day center or they went to some other program where they had some stimulation, but that stimulation isn't there anymore. So they're just in the house. So, I mean, it's as if you took the worst kind of a thing of COVID, where you have to be isolated, you have to be distanced, and you give it to a population who really need the stimulation and the interaction. It's devastating.
And Sharon,
can I add to that too? I'm so sorry. In my patients, I see this. People who are living in retirement communities who joined it so that they could get more activities and more socialization, they're actually getting less than what they before they entered. So they're declining more rapidly on an anecdotal level, meaning what I'm seeing in my patients. And then especially if they're at home, then their caregivers and loved ones are more burdened because they don't get the respite that they need from outsourcing from other support.
Right.
So Sharon, I mean, on top of that, I want to ask, so some other studies now, they're showing that cardiovascular and cerebrovascular risk factors of COVID-19, that those risk factors, they are actually, there's some correlation to them worsening dementia or there being a chance of developing the condition. So what are your thoughts on this?
Yeah, I think it makes sense. Again, it's all very early days. So cardiovascular risk factors are ones that increase the risk of developing Alzheimer's disease in and of itself. And then we also know that these cardiovascular morbidities are also an increased risk for developing COVID-19. So having those and being present in Alzheimer's disease, does that increase the risk of developing COVID-19 in Alzheimer's disease? And I think that's a very appropriate research. And there's one particular area that, some researchers have found that potentially the SARS-CoV-2 needs calcium channels to enter into a cell. And whether blocking that could be helpful for treating and preventing development of COVID. And that's something that, calcium channel blockers might be looked at for Alzheimer's disease and has been studied for Alzheimer's disease in the past. So I think it's definitely developing, and it makes sense that could be possible. But again, is it just associative or is it causal?
Well, Sharon, of course, there's still a lot that we don't know about the Alzheimer's disease, hence why there isn't an effective cure yet. But in that regard, do you think new technologies like genotyping could help? And also you're working on developing a treatment based on plasma as well. So how would this work, and what are the challenges that you're facing?
Yes, definitely. So with genotyping and understanding gene mutations and the profile for all of us, we want to know our personal data. And I think that could be very helpful in the right context. So for example, if we had a gene therapy and we knew that having a particular gene would cause Alzheimer's disease, then early genotyping and detection would be very appropriate. However, without that sort of treatment, having the data just to have the data might be risky and might cause more anxiety and distress. I'm always a big advocate of brain health and prevention, like exercise and cognitive stimulation, for what we know to help brain health. My working plasma has been looked at whether young plasma could be helpful and beneficial in treating Alzheimer's disease. So we don't know what the plasma contains, but we think there might be some healing properties that are different than in an aging person. And the research was based off of one of my colleagues at Stanford, who had given young human plasma and young mouse plasma to older mice, and then it helped the memory. So we did a small study, looking at giving young human plasma of adults to people with Alzheimer's disease. And the goal was really to see if it was safe. But the ultimate goal would be to see if there's an item or a combination of things in young plasma that could help recover the aging brain and specifically Alzheimer's disease.
Well, luckily we have scientists like yourself, working very hard on treating this terrible disease. And well, in the meantime, though, Carol, how can friends, families and members of society really support patients with Alzheimer's disease, especially during this very challenging time where social distancing is necessary?
Well, I think the main thing is, as much as you can, have contact. It's the isolation and the change of, particularly if people have to go into an institution of any kind, it's the isolation, it's the transition, which is so stressful to people and really seems to create more of a decline or deterioration. So that's the first thing. I think the families need so much support, because we always talk in the States about Alzheimer's disease being the long goodbye. That's been used for a long time. And this long goodbye is becoming even more stressful because you can't be there. So I feel so much for the families, particularly there have been so many reports about how families have had to stand at the windows of nursing homes and wave goodbye to somebody who is dying, to their mother or to their father. And if that person has dementia, it's even worse. It has to be even worse, because you can't even hold their hand or touch them or let them know that you're there. They may not even focus on you or recognize you standing at a window. So I'm hoping, I know it's going kind of state by state. I think that the government is allowing people to go into nursing homes, at least a little bit if there's COVID there, some restricted visitation, because they are people who aren't necessarily going to be able to do it on the telephone, or a video even isn't going to mean anything. They really need that contact, and so does the family. So does the family. So, COVID has only emphasized how much we don't have and what we need, I think.
I think COVID has also really emphasized these everyday tragedies that these patients and their families go through that many of us were very blind to or just lacked interest in. And I hope we, as a society everywhere, can really take more interest and try to provide more support to these patients who are so in need of help. But I'm afraid, well, this is where we'll have to end the discussion today. That was Sharon J. Shah, Clinical Associate Professor in Neurology and Neurological Sciences at Stanford Center for Memory Disorders, and Carol Cox, Professor at the Graduate School of Social Service at Fordham University. Thank you so much for joining us from California and New York.
Thank you.
Thank you for having me.
Thank you.
And to our viewers, thank you for watching. We'll be back on Monday here in South Korea. Have a wonderful weekend wherever you are. Goodbye.